Hi everybody, my name is Ben and I am a multiple myeloma cancer survivor. Just got back from my doctors and I have an IV sticking out of my arm, and the reason for that is because I am currently undergoing some treatment for relapse. I'm under the drug Kyprolis. But that's not what I wanted to talk about today. Today I wanted to talk a little bit about bone marrow transplants. Basically, there's two types of bone marrow transplants. There's what's called the autologous, which they call auto for short, and the allogenic, which they call allo for short. So the auto bone marrow transplant and the allo transplant. The difference between the two: an auto transplant, they extract your own blood stem cells from your blood. So you're using your own. With an allo, you're using a donor, someone completely different from you. However, the donor must match your blood type as well as some other criteria it must match. You just can't pick anybody off the street for an allo transplant. However, a complete stranger can be someone who can be a donor, as long as they match your blood type and whatever else they look for. In my case, when I was first diagnosed, I saw a doctor in Seattle, a professional doctor in Seattle, and he recommended that I have what's called a tandem transplant. The type of tandem transplant they wanted to give me was an auto transplant followed by the allo transplant. I have several brothers and sisters, and I was blessed to have one of my sisters be a complete match for me. So having the allo transplant for me was a definite go based on my sister. So what they did to prepare me was they put me in the hospital where I live, and I currently live in Las Vegas, and for some stupid reason they don't do transplants, bone marrow transplants in Las Vegas. I'm not sure why, because in reality a bone marrow transplant is no big deal. It's just an infusion of blood. So I don't know why they don't do transplants here. But anyway, moving on. When they were preparing me for this tandem transplant, they put me in the hospital for 5 days worth of 24-hour drip chemo 2 times. So in the month of December of '07, I went in the hospital 2 complete different times to do a week's worth, or 5 days worth, of chemotherapy. And this is the type of chemotherapy that I call the nuclear bomb, where they go in and they kill everything. So you lose your hair, you lose everything. You get sick, and you lose your appetite. 24-hour drip for 5 days in a row, 2 times. I then had to go to Tucson for the transplant. So a month later, I went down to Tucson. They hammered me with more nuclear bomb chemo, which got me sick. In the process, I had had so much chemo that killed and destroyed everything in my body that they could not extract my own stem cells, or not enough. They could not extract anything because they'd given me too much chemo and destroyed too much of my body, and my body was not recuperated enough to produce the stem cells that I needed to do an auto transplant. So we decided to move forward with the allo. So I think it was about April of 2008 that I began my journey with the allo transplant, and my sister was my donor. And for someone donating, that's quite a process too, because they stick a needle in one arm, run that person's blood through a machine, and in the other arm they give back the remaining blood that they don't use. It's quite an ordeal for the person who is the donor, because it takes several hours to extract these stem cells from that person. Anyway, again, they had given me more chemo and destroyed everything in my body again before they gave me the actual transplant. And again, all the transplant is a bag of blood infused back into you after they've killed everything in your body, and you generate new bone marrow transplant based on that person's stem cells. So you're actually generating technically new DNA based on that your donor's stem cells. So I chose the allo, and it's more riskier than a lot more riskier than the auto. There's a lot that can go wrong, and the risk of dying from that procedure is much greater than the auto. But I chose the allo in hopes that it could possibly produce a cure, even though multiple myeloma, by definition, has no cure. I was very hopeful. I did go into remission. However, the remission only lasted for 2 years. So with that in mind, everyone should realize that there are no guarantees for a cure either with the auto or the allo transplant. Basically, they are just two forms of treatment. And I've known many people who have had multiple myeloma who just had the auto transplant, and it did not give them remission for a very long period of time, and they had to get additional auto transplants. Anyway, again, you have to remember that transplants are just another form of treatment to help prolong your life. In some cases, they can potentially be a cure, and it all depends on the individual's body. Everybody's body is different and responds in a different way. Again, I thought that an allo would really put me close to a very long-term remission or a cure, but it did not. If I had to do it all over again, I would not proceed with an allo transplant. I would go with an auto because of the risk factor and the things involved. With an allo transplant, you will probably get what's called graft versus host. Now, graft versus host can be a big problem. I did get graft versus host. Graft versus host can affect your eyes. You can get dry eyes, dry mouth, sores in your mouth, all kinds of things. It can also, the big potential is it can affect your organs like your liver and I guess your kidneys and whatever. So they really check and monitor your blood to make sure those things are in check, and if not, you're going to be on some medication for a while. With my graft versus host, I was experiencing tightness in my arms and skin on my arms, my forearms, a lot of tightness, and on my legs. However, it reached a point where it did not get any worse. It was bearable. It also affected my hands. I couldn't stretch my hands didn't feel normal. I couldn't stretch them as far. It just feels real weird. To this day, I still have those issues, but they're not as bad. I do a lot of flexing and whatever, but I do sustain a little bit of tightness. To combat that, they put you on a drug called prednisone, which is a steroid. That has dangers all to itself, especially for long-term heavy dose use. I was a little disappointed with my doctor, who kept me on it for a very long time because it wasn't producing results, and my graft versus host was not getting worse, and my graft versus host was not life-threatening. My doctor kept me on very high doses, and I was very disappointed with the fact that they did not pull me off and wean me off. You have to be weaned off of prednisone, and he did not choose to wean me off in a period of time when he knew that the graft versus host was not a problem. He kept me on it and kept me on high doses. In return, it destroyed my hips. I had to have 2 hip replacements a year apart, and that was brutal all to itself. So be careful if you choose the allo bone marrow transplant. However, when I had the transplant, I never thought that I was dying in any such way. I did not experience any great deal of sickness other than from the chemo. The chemo was the only thing I experienced sickness. I could not eat for 2.5 weeks. I could not keep anything down. That even means water, too. I couldn't keep water down. With that in mind, I was in the hospital with this transplant for a total of 5 weeks. I went stir crazy. I was nuts. I wanted to get out of there. But they could not release me until my white blood cell count was up to a good level, and that they could see that I could hold down oral medication. Once I started able to hold down oral medication and my white cell count was good, they could release me from the hospital. But 5 weeks in the hospital was very brutal because there's nothing to do. With an auto, I understand that it's a lot quicker, a lot easier. The recuperation is very much easier. I don't know much about it other than people's stories. Much easier, much quicker recuperation. You just don't experience, you won't experience graft versus host. The reason why you experience graft versus host is because it's a form of rejection. Your body is realizing that there is something different in your body that's not supposed to be there, and you reject. Just like when you get a heart transplant or a lung transplant, you're going to be on medication for rejection. Graft versus host is rejection. When you're going through the auto transplant, you're using your own, your body has nothing to reject. So it's easier. So those are the points and the main points that I can touch on with a bone marrow transplant. I hope that this has helped everyone out and answered some questions. Again, my remission only lasted for about 2 years, and I'm trying to avoid any kind of transplants right now because it's not an easy process. And if I had to go through another transplant, I will choose the auto. I asked my doctor, since I've had an allo, could I go to an auto transplant? He wasn't 100% sure, but he thought there would be no reason why I couldn't. Again, I wouldn't do an allo transplant again. It's just too brutal, and I may not survive another allo transplant. Anyway, I have a website. It's called Experience to Extremes. It's a work in progress right now. It's not 100% complete, however, it is functional. My purpose of this is just to help people out and provide information the best way I can. I want people to realize that this disease, multiple myeloma, and any cancer for that matter, is very emotional. It's very physical, especially this disease. It goes after your bones, and it's very painfully physical. I've experienced many pains. And my next video, I will elaborate more on some of the things that have occurred to me with pain. But this video, I just wanted to focus on the transplants. But also, this disease is very financial. And on that website, you'll find a link in the upper right corner for a donation. If you found that, if you find that you care to donate $1, just $1 or anything, it's greatly appreciated. If don't donate, if I'm not asking you to donate anything really. That's up to you. So again, $1 donation would be greatly appreciated. Again, I'm just trying to help people out. This disease has robbed me of my career, my job. It has robbed me of many things in my life. So any kind of help would be appreciated. And I thank you for watching my video, and hopefully I can help people out in the same. Thank you.